members. Therefore, as the chair of, as the lead secretariat of the City Disaster Risk Reduction and Management Council, I now recommend for the declaration of the quorum. And in behalf of our city mayor, who is equally important meeting for today, but our city administrator will be catching up for this meeting. And I now call this meeting to order and turn over this microphone to our City Health Officer to preside the meeting.
Good afternoon, everyone. Good afternoon. Thank you, Ma'am Choleng. First of all, we would like to tell you that as of today, whatever you heard in the news is fake news if there is COVID-19 in Tuguegarao City. So far in the whole of Region 2, there's no COVID case. And as far as that, at the outset, para mamali yung fears natin, a lot of people have been commenting on in the Tuguegarao e-group, especially among the department heads, please don't, if there is one thing that I would ask is, don't post anything there that you do not verify, because it's creating a lot of panic, and it's creating a lot of scare, among all of us. So before you click on that, and post it to our to our group, then please, verify it from us. Whoever you think you believe would give you the best answer, please PM that person rather than asking through that e-group. So again, let me give you an appraisal of what we're doing right now and what we are supposed to do with the onslaught of COVID-19. Sabi nga ni Mayor, it's just a matter of time, before we're gonna get the virus. But siguro mas gusto ko na nakatayo and I can use the podium. Please allow me to use the podium. Okay, let's look into the situation based on numbers as of March 15, 2020. Total of new cases in the last 24 hours. Globally, 153,517 confirmed cases, 10,000 of which are new cases. 5,735 deaths, 343 new ones. So, may contribution yung Pilipino dyan. China, 81,000 confirmed, 27 ang bago lang. See? And 3,204 deaths, 10 lang ang bago sa kanila. Outside of China, we have 72,468, confirmed. 10,000 of which, 10,955, are coming from outside of China. Okay? And it is now in 143 countries and territories. Kasi hindi naman countries, territories yung iba. And just a couple of days ago when I did my report, it was only 114. And just for yesterday, there are 9 new territories or countries, with positive cases of COVID. So, in terms of WHO risk assessment, China, they consider it still very high, but it's already on the downtrend ang kanilang On the regional level, in any of the regions for WHO, it's still very high, and globally, it is still very high. So what does that mean? We should never put our defenses down. Okay, let's go, next. Okay, ito ang coronavirus disease as far as tracker for the region. Ang nakalagay dito, as for the region, makita natin dito, I hope you can see it, there are 17 municipalities and cities, pero wala ang Tuguegarao City, as far as the number of persons under investigation right today, as of today, as of yesterday pala. 5 p.m. kasi nag-update sila every afternoon. Okay? So wala ang Tuguegarao, ang nakalagay dito, hindi ko na babasahin kasi it doesn't concern us, no? So cumulative total of persons under investigation since January, 56 the whole of the region. Cumulative total of discharge, no? 39 kasi wala pang nagpa-positive, no? So persons under investigation according to Dr. Valencia this morning, he said that there are 21, no? Palagay ko na discharge, as of yesterday afternoon, so nag-increase na yan ng 21. So, we should have more people as persons under investigation. Yung Chinese national na yon, no? For your information, no? Is a graduate student of one of the universities. He doesn't have any symptoms, but since he came from Shanghai, no? Nag-voluntary na pumunta kay sa consultant at nagpa-quarantine. Instead of the home, pumunta siya sa ospital. So I think it's let us not do some speculations, no, about that para wala akong scare, wala akong panic na nagko-cause sa atin. Kasi I know there's causing a lot of panic. Okay, next please. Okay, the same yan, V. Next, please. Okay, for Tuguegarao situationer, persons under investigation, 6, 3 na ang na-discharge, yung 3 are on home quarantine. So what does that mean? Wala ko tayong naka-confine. Yung home quarantine na yan, mild yung symptoms nila, at saka mukhang na-fulfill nila yung kanilang requirements. Okay, we will discuss what home quarantine means later. Okay, next. Okay. Country situation are Philippines, confirmed cases 127, and then deaths 11, recovered 2. But don't believe too much on these numbers. In fact, what am I trying to point out? The numbers are very dynamic. Okay? Very dynamic. Today, as we are talking now, there might be some who are added as to the number of confirmed cases and as to the deaths and also as to the recovered. Okay? So don't focus yourself on numbers. No? There are other things that we have to focus on rather than on the numbers. Give that to the Department of Health, give that to the health people. Okay? They will give you a good data as far as numbers are concerned. Okay? Next please. Okay. Okay, ito yung data ng Regional Health Office based on our NDPs. Pero ito lang yung dumating sa barangay, no? PUMs under home quarantine, 20. PUMs completed 14 days of home quarantine, 23. Okay? However, meron tayong mga dagdag sa PUM. Sino po sila? Yung mga estudyante nyo na pinauwi. Okay? They are on PUMs, or persons under monitoring. And the reason why we're considering them as persons under monitoring is because they come from a city or a place wherein there is sustained community transmission. When we talk about community transmission, that means, no, hindi na natin mapipinpoint kung kanino galing yun. Okay? Hindi gaya ng mga first number of cases na napipinpoint natin, nako-connect pa rin natin. When there's community transmission, the chances are, no, hindi na natin. So nakasalimuha mo, hindi mo kilala dun sa nakasalimuha mo kung saan mo nakuha. But definitely you cannot have the infection not unless there's someone who's positive. Whether it's a subclinical, a mild symptom, no? Hindi natin alam, but sigurado ho may pinagkuhanan ka, no? Let us clarify that. Wala akong magkakaroon ng COVID-19 na hindi ho na-expose sa isang tao na meron. Okay? So, okay, next. Okay? Things you can do now. Let us repeat this. Wash your hands frequently and regularly. Okay? Avoid crowds. So what does this mean? This is actually social distancing. The very reason why we have a lockdown or a community quarantine is social distancing. Okay? Kailangan wag ho gaya nito. No, I think I will have to congratulate everyone that you know what social distancing means. It should be at least 1 meter, ideally 2 meters away. Okay? Avoid crowds, stay home as much as possible. Okay? You avoid crowds by staying home. Watch Netflix, meditate, pray the rosary. Huh? Let's all do that. Okay? Work from home if possible. Okay? Marami na ngayon, no? Especially those that are clerical, you can send it through email. If you are sick, stay home unless you need to see a doctor. Even kami ngayon, may bagong protocol, no? And let's follow the protocols that were very successful as far as Macau is concerned. You know, Macau, wala na silang bagong mga kaso. Okay? And I'll tell you what they did. Older people greater than 60 should avoid going out at all. Okay? Ako sana wala ako dito, 62 years old na ako eh. And don't spread misinformation. That's one of the most important things, no? At this time of a crisis, no, that we have, please avoid posting anything in your Facebook accounts. Okay? What you can do to help, listen to instruction from authorities and follow them. Okay? Kami daw ang boss ngayon, no? Pero hindi ho kami boss, not until, no, everyone will have to do what we ought to do. Be self-sufficient as much as possible, but buy just enough supplies, but don't hoard more than you need. Okay? Let me repeat. Wala na po kaming mask. Okay? Wala na po kaming mask. Sino nangangailangan? Kami. Once na infect kami, ha? Lahat ng pupunta sa amin, may infect din kayo. So those who have masks, share it with your friends and family. Okay? Including alcohol. Okay? So follow quarantine if necessary. That means people who come from Manila should stay home. Okay? Even children who are playing basketball is a contact sports. Hindi ho pwede. Okay? This is the time wherein I would encourage my children to play, what's this? Yeah? Yes. Mobiles and watch Netflix. Okay? Okay? If you are sick, inform your doctor and don't hide. Okay? Ito ho ang isang maging problema natin sa barangay. May mga iba na ayaw nilang sabihin kung saan sila galing, ha? And if possible, tinatapo nila yung mga family members nila. Well, eventually, kung meron magkakasakit sa kanila, hindi nila maitatapo. Okay? At sisi ang kanilang Okay, what doesn't help? Spreading unverified and fake news. Okay? Again, panicking and yelling at people, refusing to follow duly constituted authority, demanding unwarranted testing and medical care. Okay? Lahat po tayo nangangailangan. Ha? But trust us. Okay? We will prioritize first who needs treatment or care, and then number 2, who needs the testing. With the limited test, no, this is a global problem. Everyone would like to have as many tests as they can. Okay, we're a poor country, let us remember that. We're not as rich as South Korea, we're not as rich as Japan, or the United States, or Italy. So, maski pa kung may pera tayo nakapiranggot, wala pa tayong mabili. Okay? We're trying to develop the DOH through the National Institute for Health of the UP system is trying to develop a test kit. However, it is not yet FDA approved, so we'll still have to wait. So right now, we still get our supplies from abroad, and it's limited. Okay? 1, it is limited. Number 2, it's costly. Okay? Demanding special treatment over others. Okay? Okay? Ito po yung morbidity or fatality rate. If you're 80 years old and above, 22% that your chance to die. 70 to 79, 8.8%. 60 to 69, which where we belong, it's 6.3%. Below that, it's 1.3 down the line. Okay? If there is one thing that's good about this is children are least affected. Okay? So next, please. Okay, recommendations. We're trying to intensify health information and advocacy. Okay, ano po, paano yan? Sa akin, nagka-agree ako sa lahat ng interview. Okay, but we make it short and we have to make sure that the communication, the basic information should be more or less short and what is necessary. Okay, encourage, what do we do? Encourage frequent hand washing, social distancing, correct cough manners, and staying home when sick, going out only for necessities. For persons coming from areas with community transmission like Metro Manila, Cavite, Pampanga, kung saan may kaso. Okay? And of course, abroad. Alam naman natin, nakikita natin, more than 140 countries already have it. For voluntary home quarantine for 14 days. Okay? Separate rooms, including utensils. Use of face mask by your family members who just came home. Kasi sila ang pwedeng uubo at sisipon, magbigay kayo. And universal precautions, hand washing. You don't have, yung kind issues of okay, aside from that, no, yung hand washing, use soap and water. Okay? Use soap and water. Rather than conserve your sanitizers when you go out. Okay? Let us not be wasteful at this point in time. Okay? We have all the reasons to be na magtipid at gamitin natin kung saan kailangan. Gaya saan dyan sa baba, kailangan i-regulate natin. May mga iba na 2 pump, no? Tapos babagsak lahat sa floor. Okay? Let us not be wasteful like that, no? Issues on non-cooperative cooperative PUMs in barangays. I think, Kap, this is very true, pero I think we'll have to put our foot down. No? If there is one thing that we have to be really determined to do is we monitor our PUMs. Kaya nga tawag sa kanila persons under monitoring. Okay? So daily updates through calls using cell phones. Ito ang pinopropose ko ngayon. And it's not novel here. Hindi lang tayo gumagawa nun. In fact, that's a data from Macau. Health workers do not necessarily meet face-to-face with the clients. Unang-una, magbigay kami ng I think I'll buy more SIM cards, no? Para pwedeng tumawag kayo dun sa 3 naming doktor. I don't know if McCoy can help us here. Some of the doctors can probably, we give you some SIM which patients can call so that we can give you the proper instruction. Okay? Yun ang isa sa pinakano. And you only see the doctor when it's necessary. Okay? Hindi lahat po na mububuhat sumipon ay COVID. But, no? We can probably screen through our conversation or our interview with the patient. Kasi pinaka-importante, saan ka ba galing? Okay? Kailan nagsimula? Kailan ka dumating? Sino ho ang nakasalimuha mo? In fact, there was one professor from the University of Cagayan State University who just came. Kaya na-delay ako. I had to have a good 10-15 minutes conversation with him, asking me, because he developed sore throat and he just came from Manila last March 9 or March 10. And nagkaroon siya ng So anyway, I'll cut on that, no? But definitely, I gave him my number. We can monitor him on a daily. They call us just in case symptoms are bad. Okay? But definitely, if you have symptoms, go for home quarantine, separate rooms for everyone. No? Lalo-lalo na yung may mga symptoms. Okay, next please. Okay, recommendations, rational and correct use of the face mask. Okay? The face mask should always be the colored side outside. Okay? Mali yung sinasabi ni Doc Isko. Ha? Mayor siya, hindi o doktor. Okay? So, thermal scanning of all visitors and clients in airports, bus stations, and other public places, government and private offices, hotels, and restaurants and malls. No? If ever, advise consult, temporarily defer transaction. Ayaw naman natin na ma-infect si Mayor. Ayaw naman na ma-infect natin si Treasurer. Tsaka yung mga personnel natin dito, baka eventually no one will be left here in the City Hall. So again, no, if they have fever and they have signs of upper respiratory tract infection, we advise them. It's not an emergency probably. I think all government offices right now, including private, no, they were talking, Bangko Sentral has lowered all interest rates and all, I think that's a worldwide move, no? To give way to people or to assist people in these times of crisis. Okay, next please. Okay, recommendations, active monitoring of PUM. Here, we have to review the role of the health emergency task forces, CAP. I think we have to, make them functional. Okay, yung role ng barangay officials together with our midwives, our barangay health workers, our BNS, and our Nurse Deployment Program personnel from the DOH. Pero alam mo, ito ang sinasabi ko. We get the cell phone number and we talk to them. If we can use the cell phone to text others, no? Please, let's make use of this technology right now, no? For us to be able to control this COVID-19. Okay? Okay, referral flow for PUMs, develop signs and symptoms. That means they have respiratory symptoms and fever and diarrhea. Yun yung most common. For telephone referral, okay? This is for verification of condition and proper instruction. I'll give you my CP, no? Never mind, even if even if it gets to be ano, okay, my number is 0917-578-1029, or you can call the CHO hotline, 0917-136-1358. I think for the next few days, I'll get more SIM so that I can give it to the two other doctors with us. We will have a very basic information. Don't go for information. It's more of symptoms. Consult ito telephone consult. Huwag naman na tumawag na, ano po ang COVID, Doc? Ano po ang ganon? Nababasa na po natin yan sa internet. It's the same information. What you know and I know are probably more or less the same. Okay? Referral to hospital, CVMC of PUIs or persons under investigation, so that we will be the ones to make the arrangement. Okay? Just a case in point. Okay? Yesterday, I got a call from someone, okay, telling me that there's a PUI, a patient, no, who came from Manila and developed symptoms. That patient believed, no, that he was exposed to someone else, no, dahil itong kasama niya na nag-lunch, yung taong yun had a roommate in Makati who turned out to be positive. Okay? So, I made an arrangement. I connected him to the proper authorities, which is Cagayan Valley Medical Center. We had to make sure that before he goes to the hospital, he gets a mask. Bright yung pasyente. Hindi siya umuwi. Taga-Tuguegarao siya. He's a 25-year-old male. Okay? I will not say that. Okay? What he did was to get a room in one of the lodgings here in Tuguegarao. So he went straight to that room. We were able to get in touch with him. He was very cooperative. Okay? At the end, what happened? I got him connected with Dr. We assured him that it will be, information will be with confidentiality. Okay? We sent him a mask. Okay? Napadala kami ng mask kasi malapit lang sa ospital. Ginamit na yung mask. The instruction was, wear that mask, go straight to the tent, containment tent. Okay, so he went to the containment tent, he's now in CVMC. One thing good about it is, later in the evening, I called him up, and he said that the person whom he believes, no, to have na-infect sa kanya, turned out to be negative yung result niya. So that's one good news. Okay, so but we're still monitoring him based on the protocol. Okay, next please. Okay, what are other recommendations? Regular disinfection of frequently utilized areas in public places, including classrooms. That we're doing right now. Kompletohin namin yan, no? With ma'am, yung sa University of USL, ma'am, we will do the what's this? Yung areas lang na ginamit, and then we will give you the others to do it, ha? Kasi ma'am, it's easy. How do we do it? Sodium hypochlorite, no? Pero alam ko sa shelves ng groceries at saka wala na. But do you know how much do you use for hypochlorite? Your 1 gallon should be equivalent to 100 gallons. So isa lang siguro, ma'am, magagawa na lahat doon sa eskwelahan nyo. Bakit? You just spray the floor and the surfaces of your furniture and wipe them off. Okay? Hypochlorite is on rocks. Okay? I don't want to make it's a bleach actually. Okay? Yan yung panglabada nyo. And if you want something like fragrant, then you choose the variety or may siya. You can also use another you can put downy, no? Or softener, no? Cloth softener, no? Downy yun. Nagagawa na tayo dito ng commercial, they should pay us. But at any rate, pati tayo sa mga offices natin, so alam mo yung 1 gallon, yung 1 gallon, punin niya ng tubig. How many liters of hypochlorite do you use? 40 ml. Okay? 40 ml is around 4 tablespoons. Sobra na ba yun? 4 tablespoons, and that's what you spray. Okay? That's what we use for HIV control in our facility, including our instruments. Okay? So you don't have to buy the very costly Lysol or whatever. Use hypochlorite. It's still the best, and it's still the one recommended by both WHO and all the other facilities. Okay? Provision of hand sanitizers. Ito, medyo problema natin. I wanted to buy additional 15 or 20 gallons. It's not available anymore. So we're very limited quantities. Of course, we did border operations, no, with the PNP, with the CDRRMO, the City Health Office, the DOH, and of course the barangays. No? What are its scope and span? Okay, the very reason why we did border operations, no, for the past, naikuttot ito, ng Saturday morning and Sunday morning. Why? Because there was an influx of people coming in, whether they're students or those that do not have work in Manila. Okay, we provided for forms and the data collected. We still have boxfuls of information there. Okay? Do we need the information now? Hindi po. What we do is we sort those out based on the conveyances, yung buses, so that just in case one turns out to be positive, we will identify who were with him or her in the bus, and then we can do immediate contact tracing and containment. That's the very reason. Hindi ho yung datos na yan kailangan na kailangan. Kailanganin natin yan pag may nagpositibo. Pero pag hindi natin ginawa yan, okay, wala tayong datos na babalikan, wala tayong datos na magagamit. That's the reason why we're doing that. Okay? And what we did was initially on that Saturday morning, and I'm very thankful, Chole, you are let me commend your staff, kasi sa akin, dalawa lang kami. We go up the bus, we tell them the reasons why we're doing this, konting abala, pero we tell them that it's for their protection and the protection of their families. Okay? And nobody resisted, I tell you. Wala hong, everyone had very good, they were all nodding, and nobody did not, I believe that lahat ko sila nagpadala ng nagbigay ng information sheet. Although kulang-kulang. Okay? Earlier, what was our agreement? Let me just backtrack, no? In that meeting, again, with the local health board and everyone there, no, including the BNP, ang agreement namin was the bus station giving the forms in Manila. But because it was really short notice, sabi ko, I cannot blame them. So what we did was to reproduce the forms, and before they alighted or they got off the bus, binigay namin. Ngayon, the next day, okay, halos lahat na ng mga buses coming from Manila were ready with the And definitely, if you're not rushing, that you can better complete the form. Okay? So may I ask all of us here, that if you have relatives and friends, you tell them the wisdom of what we did, and just in case another thing happens like that, then they have to follow and abide. Okay? Next, please. Okay, what are the other issues and concerns that we have? Much as we would like to buy thermal scanners, its availability is a big question right now. Even in the net, okay, you cannot. Not available lahat. The cost, we used to buy it for less than 500 pesos or 800, yung magandang klase, or 1,000. You know how much it costs now? It's 3,500 to 8,500. Maski sana kung gusto mo pang bumili ng 8,500, wala akong available. Okay? Well, let me just tell you what are the benefits of doing a thermoscan. Okay? In a thermoscan, like for example, in an area like this, bakit natin ginagan sila? Para hindi na siya papasok. Pero alam mo, yung sa mga iba na yung pumapasok sa Tuguegarao na nandun sa bus, we can only give them the advice to see a physician. Okay? But for us to limit or not getting them to Tuguegarao, I really don't know how it will sit with all of us. Baka may human rights tayo. And what action should we take? Na wala tayong thermoscanners. Okay? Ito ang hinihingi natin. Okay? Kailangan truthful yung Anyway, I'll put that as one of the issues. Okay? Alcohol-based sanitizers, questionable ang availability. If you go to the groceries and supermarkets now, wala na hong alcohol. I really don't know whether there's a way of doing it by the using of the vodka. Okay? Because you only need 70% isopropyl. There's a way in the net. I haven't done it, telling you frankly, I haven't done it, but this time you can use your vodka. Okay? Or your gin, which is 86 proof ba yung gin? 86 proof, 80 proof. 80 proof. Okay? Naubos sa dumating ng gin. You can use it to wash your hands, And then yung proper use. So without the sanitizers, hindi mo tayo mamamatay. Maghugas lang mo tayo. Ha? Okay, next please. Okay, para bilisan natin at si Chole. Okay. Okay, I just got this off from the net, no? How effective are thermal scanners in detecting people infected with the new coronavirus? Sabi niya, thermal scanners are effective in detecting people who have developed a fever. Okay, fever. Have a higher than normal body temperature. That's how they define a fever because of infection with the new corona. However, they cannot detect people who are infected but are not yet sick with fever. So, pag subclinical ka pa, hindi ka pa nag-manifest ng ano na yon, then hindi niya maano. So, ilan lang nakukuha ng thermoscanner natin? Very few. Very few. Okay? This is because it takes between 2 to 10 days before people are infected, become sick, and develop a fever. According to Dr. Carlo, no, in his initial, in our initial encounter with him, no, in the local health board, usually daw, no, it doesn't take really long, like 14 days, not unless na malakas masyadong resistensya mo or beyond, no? But usually 3 to 6 days, nagmamanifest na yung symptoms mo of cough, fever, or diarrhea. Okay, next please. Okay, issues and concerns, fake news in social media. Let's just repeat. Sinong nagkakalat? Okay? Sana hindi rin tayo ang kasama dito. When are we supposed, are we supposed even to repost it? And how does it happen? You know? Okay? So, I really don't know. No? It's more of a responsibility among each and every Hindi porke may cellphone ka, gusto mo maging sikat, post tayo ng post. Sa akin, in my own Facebook account, I don't post that often. Okay? Okay? If you want to post, rather than posting news about COVID, post what you ate yesterday. Okay? Okay? So, communication plan. Okay, ito is very important in a crisis, no, or in a calamity, or in a situation that we're facing right now. Okay? In terms of the source, okay, sa akin ayaw kong gumawa ng sarili kong plano if it's not based on the recommendations of the Department of Health. Okay? So the source and the timeliness. Kailan ba natin dapat ilabas, no? Yung ano na ito. Okay? And it is more for prevention. Okay? Let's give also regular updates. In fact, there was one among us, no, in that e-group who said that I should now make a official statement. Sabi ko, why should we make an official statement when we never had that statement done by us anyway? So sa atin, there are news, no, especially that just ignore it, you know, because it dies down. Every time